P.A.I.N, a smarter prescription for injury recovery. Most people think pain means something is broken, fragile, damaged, something that needs to be stopped, rested, or shut down. And if that's what you believe, you didn't invent that idea. It came from the man. The man represents the old way of thinking about injury recovery. Pain is bad, pressure is dangerous, inflammation must be eliminated, movement should wait until everything feels perfect again. It sounds safe, it sounds responsible, and yet people stay stuck, stiff, guarded, afraid to move. The core truth. Here's the truth most people never hear. Your body is already incredibly good at healing most injuries. Muscle, tendon, fascia, bone, these tissues don't need rescuing, they need cooperation. When you understand how healing works, you can follow a simple prescription that supports the body's natural repair processes. We call that prescription P.A.I.N. Introducing P.A.I.N. Pain isn't something to fear, it's something to understand. P.A.I.N stands for pressure, analgesics, inflammation, neuroengagement. This isn't something done to you, it's something you follow with expert guidance when you need it. P equals pressure. Pressure is one of the most overlooked tools in rehab. Deep kneading, shearing force, targeted vibration. Pressure isn't about punishment, it's information. It improves circulation, it wakes up underused tissue. It tells the nervous system, this area still exists and it's safe to access. Most rehab minimizes pressure. The man says, don't touch it. Your body usually says, please touch it, intelligently. Why pressure matters. Pressure stimulates sensory receptors. It changes how the brain maps the injured area. It reduces guarding and restores motion. Pressure doesn't damage healthy tissue. Avoidance does. A. Analgesics. The word for pain is algia, and "an" is the prefix meaning without. Thus, analgesia is literally without pain. An analgesic is something that takes away your pain. Analgesics aren't about ignoring pain, they're about preventing pain from hijacking your nervous system. Pain causes guarding. Guarding limits movement. Limited movement delays healing. Analgesics create a temporary window, a quieting of the alarm, so you can do the next step properly. Which brings us to, inflammation has been taught as the enemy. The man says, stop it, suppress it, eliminate it. But here's a better way to understand what's happening. An injury is like a house on fire. Acute inflammation is the fire department rushing to the scene. Blood flow increases, immune cells arrive, repair materials are delivered. This isn't chaos, this is organized emergency response. Anti-inflammatory drugs don't put out the fire, they stop the fire trucks, they slow the firefighters, they delay the repair crew. The fire doesn't disappear, it just smolders longer. Just to be clear, this isn't medical advice and it doesn't replace care from your physician. Anti-inflammatory medications absolutely have an important role, especially in severe injuries, autoimmune conditions, or uncontrolled pain. What we're talking about here is timing and context, so healing isn't unintentionally delayed. Acute versus chronic. Chronic inflammation is a problem, but acute inflammation is how healing begins. When guided properly, with pressure and movement, the body repairs more completely. Our goal isn't to eliminate inflammation, it's to work with it, not against it. N equals neuroengagement. Neuroengagement is where everything comes together. This is movement, but not mindless movement. Neuroengagement is a conversation between your brain and your body. Every slow, controlled movement asks a question. Is this safe? And the nervous system responds, yes, or not yet. Through gentle, purposeful motion, the nervous system updates its map. Confidence returns. Coordination improves. Range of motion expands. Strength follows trust. This is how fear dissolves. This is how movement comes back online. Pressure prepares the tissue. Analgesics reduce unnecessary guarding. Inflammation initiates repair. Neuro-engagement restores confidence and control. That's pain, not something to fight, something to follow. When you understand the process, you're already empowered. And when you want expert guidance, someone who understands pressure, nervous systems, movement, and recovery, that's where we come in. We don't fix bodies, we help people work with theirs. The old system fears pain. We teach you how to use it. Welcome to a smarter way to heal.